Hello, I'm Dr. Syed Tausif. I'm a consultant radiation oncologist at Care Hospitals High Tech. In today's patient education video, we'll be discussing about rectal cancer. We'll focus on how rectal cancer presents, what are the common symptoms, and what is necessary to evaluate and diagnose a patient of rectal cancer. So first, let's know what the rectum is. So the rectum is the last part of our large intestine that measures approximately 12 to 15 centimeters in length. It ends into the anus through which the feces is excreted. So what does the rectum do? It is basically a storehouse of feces. So whenever feces accumulate in the rectum, its walls stretch and this causes the urge to defecate. So an abnormality in the rectum would affect this particular mechanism. So a patient of rectal cancer would very commonly present with altered bowel habits. So frequently there is an increase in frequency of defecation. Sometimes the mass in the rectum, the tumor in the rectum, could also obstruct the lumen. So this would cause patient to feel difficulty while passing stools. A lot of time the tumor in the rectum can bleed. So patient may present with blood in the feces. So all these symptoms that I've just mentioned mimic the symptoms of hemorrhoids or piles. So it's very common for us to encounter patients who have been misdiagnosed as piles and they've been treated for piles but with no benefit. And eventually we find out that they have rectal cancer. A lot of patients can present with non-specific symptoms such as generalized weakness or loss of appetite or weight loss. So when a patient comes to us with the above mentioned symptoms and when we have high suspicion of rectal cancer, initial evaluation would be done by a simple examination of the rectum by the doctor. So any suspicious finding on the local examination. So when a patient presents with the symptoms that I've just mentioned and there is suspicion for rectal cancer, the initial evaluation would be by a simple local examination of the patient. So we would examine the rectum to feel for any abnormal ulcer or growth. Any suspicious finding on local examination would be confirmed by a proctosigmoidoscopy. Proctosigmoidoscopy is a relatively simple procedure. It is an outpatient procedure wherein a scope is advanced through the anus into the rectum and to the lower parts of the intestine to look for any suspicious ulcer or growth. This scope has a tiny light and a tiny camera with the help of which the doctor can visualize if there is any abnormality. Any abnormality noted in the rectum, the doctor proceeds to take a biopsy from it. A biopsy is nothing but taking a tiny bit of tissue from the abnormality. This tissue is then sent to the laboratory for microscopic examination. The microscopic examination would tell us whether there are any cancer cells in this growth, and any confirmation of the presence of cancer cells would confirm the diagnosis of rectal cancer. Once the confirmation of rectal cancer has been made, the doctor would proceed to evaluate for the stage of the disease. So we would do imaging investigations such as CT scan, MRI scan or a PET CT scan as appropriate in a patient, and this would be to confirm the stage of the disease. By this I mean that whether we have to, staging of the disease is important because this guides the treatment intent as well as the amount of treatment that the patient would receive.